child with special needs. Today in this we are going to deal with the topic physical disabilities. The objectives of learning this lesson is to impart knowledge on the basic issues concerning physical disabilities like the classification or types, the characteristics or symptoms, etiology or causes. The second objective is to plan developmental intervention programs for children with physical disabilities. For this, knowledge about the diagnosis, treatment, management, therapies is very much needed. So, what is physical disability? Physical disability pertains to total or partial loss of a person's bodily functions like walking or motor skills, and total or partial loss of a part of a body. For example, a person with amputation. A physical disability is a limitation on a person's physical functioning, mobility, dexterity or stamina. Other physical disabilities include impairment, which limits the other facets of daily living like the respiratory disorders, blindness and epilepsy. The Indian government provides 3% reservation in government jobs and education in government funded educational institutions for the physical disabled, but the disability should be 40%. But this benefit does not apply to all classes of disability. It excludes the mentally disabled children. The Indian Railways also provides concession and reserves 2 seats in lower sleeper class berths for the disabled people. This includes both the physically disabled and mentally disabled. The physical disability falls under these headings: the limited control of some or all voluntary muscles, underdeveloped skeletal structure and dysfunctional joints. A person with physical disability may require some assistance and the use of some sort of equipment or to aid the mobility. Orthopedic impairment can severely affect a child's educational performance. The term orthopedic includes the impairment that can be caused by congenital anomaly, the impairment caused by the diseases like poliomyelitis, bone tuberculosis, and impairment from other causes like the cerebral palsy, amputations, fracture, and sometimes the burns can also cause contractures. There are wide range of neuromuscular and orthopedic impairments that are congenital or as a result of illness, or they can be accident related also. The mobility impairment range from slight difficulties with movement to paralysis. Such impairments may be caused by disorders like arthritis or multiple sclerosis, or they can have congenital causes such as cerebral palsy or muscular dystrophy. They can also be the result of illness, accidents, strokes or injury to the spinal cord. The term physical disability is broad and covers a range of disabilities and health issues. These include both congenital as well as acquired disabilities. Within that range of physical disabilities or impairment that interfere with the child's ability to attain the same developmental milestones as his or her age mates. The number of students with physical disabilities is expected to grow. You know why? Because the medical advances are continuing to reduce the mortality rates for infants and children. So, because of this reason, the physically disabled children are growing in number. According to the Individuals with Disabilities Education Act, a person with orthopedic impairment, brain injury or health impairment who by the reason of that impairment needs special education and related services is considered to have a physical disability. The condition must interfere with or it has to substantially limit the child's ability to take part in routine school activities. A physical disability or a health condition need not limit the activity. Instead, it may involve other restrictions, or the students need to use some type of medical equipment to aid him. After having an understanding of physical disability in general. Now we will see what are the different types of physical disabilities. The first one is arthritis. Arthritis is a form of joint disorder that involves inflammation of one or more joints. There are 100 different forms of arthritis. The most common form is osteoarthritis. It is a degenerative joint disease. It results because of trauma to the joint, infection of the joint, or because of the age. Other arthritis forms are rheumatoid arthritis, psoriatic arthritis, and related autoimmune disease. There is an arthritis called septic arthritis. It is caused by infection to the joint. The major complaint by the individuals who have arthritis is joint pain. The pain is often constant and may be localized to the joint affected. The pain from arthritis is because of the inflammation that is occurring around the joint and damages to the joint from the disease. It can also occur because of the daily wear and tear of the persons. The muscle strain caused by forceful movements against stiff, painful joints, and sometimes it can be resulted because of fatigue also. Diagnosis. Diagnosis is made by clinical examination from an appropriate health professional and may be supported by other tests such as radiology, blood tests, depending on the type of suspected arthritis. Now we will see what are the different kinds of arthritis. Rheumatoid arthritis. Rheumatoid arthritis is a disorder in which body's own immune system, it attacks the body tissues. The attack is not only directed at the joint but also to other parts of body as well. In rheumatoid arthritis, most damage occurs to the joint lining and cartilage, which results in erosion of two opposing bones. Rheumatoid arthritis often affects the joints in fingers, wrists, knees and elbows. What can be the symptoms of rheumatoid arthritis? Let us see. Pain with joint movement, limitation in joint movement. In some cases, we can also find fever, and it may lead to contractures and sometimes visual impairment also. The second type of arthritis is osteoarthritis. Osteoarthritis is a common form of arthritis. Today, we can see everyone suffering from this osteoarthritis. It can affect both the large and smaller joints of the body, including the hands, feet, back, hip or knee. The risk factors of osteoarthritis include prior joint trauma, obesity and sedentary lifestyles. Physical therapy to strengthen muscles and joints is helpful in these cases. Pain medications are widely required by the individuals with osteoarthritis. There is no cure either for rheumatoid arthritis or osteoarthritis. The treatment options vary depending on the type of arthritis and include physical therapy, lifestyle changes like you have to include some sort of exercises, weight control, diet and orthopedic bracings and sometimes medication also. Joint replacement surgery may be required in eroding forms of arthritis. Medications can help reducing the inflammation in the joint which decrease the pain in the joints. Moreover, by decreasing inflammation, the joint damage can also be slowed down. So, what is the difference between rheumatoid arthritis and osteoarthritis? The difference is osteoarthritis is common form of arthritis and it is non-inflammatory form of arthritis and it can be usually diagnosed by an X-ray. Rheumatoid arthritis is a inflammatory form of arthritis where the immune system attacks the joints and is often diagnosed by blood test. This is the type of physical disability called arthritis. Now let us see the second type, multiple sclerosis. It is one type of degenerative disease. Multiple sclerosis is an inflammatory disease of central nervous system. Central nervous system means which includes the brain and the spinal cord. Predominantly, it can be called as a disease of white matter tissue. This disability affects the motor movement. The child with degenerative disease needs more complex adaptations, assistive technologies and devices in school. The most common degenerative disease is Duchenne muscular dystrophy. The degenerative disease can be characterized by progressive muscle weakness from generation of muscle fiber. By age of 3, the child legs begins exhibited a thorough difficulty in walking or running. When the child is around 10 to 12 years of age, the child can no longer walk and needs a wheelchair. And sometimes their respiration becomes difficult and he may die as early as 20 years. What are the causes of multiple sclerosis? Let's see. No one is sure what causes the body's immune system to go awry in multiple sclerosis. Some scientists believe that it is a combination of genetics and something in the environment to which the person was exposed in the early of his life. What are the symptoms? Symptoms of multiple sclerosis vary from person to person and can change from time in the same person. The most common symptoms include muscle weakness, decreased coordination, blurred or hazy vision, eye pain and double vision. As the disease progresses, the symptoms may include muscle stiffness, which is called as spasticity, pain, difficulty controlling urination, and they may also have problem with cognition. How can this multiple sclerosis to be diagnosed? Making the diagnosis of multiple sclerosis isn't easy because the symptoms are vague and often fleeting. Factors that a health professional considers are 2 or more isolated episodes of symptoms that can be caused by multiple sclerosis. The episode must last at least 24 hours and it has to occur a month apart. MRI test shows the area of demyelination, which is the lesions. Treatment. What can be treatment for multiple sclerosis? There are variety of medications available that can reduce the frequency and severity of symptoms in some people with multiple sclerosis. Some drugs can also slow down the progression of certain types of multiple sclerosis. Now, next type of physical disability is muscular dystrophy. Muscular dystrophy is a group of genetic diseases characterized by progressive weakness and degeneration of skeletal or voluntary muscles which control the movement. The muscle of heart and some types of other involuntary muscles are also affected in the muscular dystrophy, and few forms involve other organs as well. Next type of physical disability is crippling from infections. Of this, poliomyelitis, which can also be called as infantile paralysis, and the second one is osteomyelitis. Now, first let us see what is poliomyelitis. It is often called polio or infantile paralysis. It is an acute virus infection and can spread from person to person, primarily through the fecal oral route. This term polio is derived from the Greek word which means spinal cord inflammation. Osteomyelitis. Osteomyelitis is more common invasive bacterial infection in children leading to hospitalization and prolonged antibiotic administration. The signs and symptoms of osteomyelitis. The symptoms of osteomyelitis include pain, swelling, warmth, redness at the site of affected bone, persistent back pain that is not relieved even by rest, heat or painkillers, abscesses with pus in the tissue surrounding the painful bone, and in some cases we may also find fever and fatigue. What are the causes of osteomyelitis? An infection caused by bacteria or fungus. It can develop in bone or spread to the bone from elsewhere in the body. Osteomyelitis can happen after a fracture or any other injury, or sometimes as a result of joint replacement also. The infection can also spread beyond the bone, creating abscesses in the muscle and other tissues outside the bone. Treatment. The chronic osteomyelitis is treated with surgery and antibiotics. Acute and vertebral osteomyelitis may be treated with antibiotics alone, and it depends on the type of condition the person is facing. Sometimes a cast or splint to immobilize the affected bones and joints can also be done. Now let us see the next type of physical disability: congenital malformations. A congenital disorder or congenital disease is a condition existing at birth and often before birth, or that develops during the first month of the life, that is the neonatal diseases, regardless of causation. There is no particular cause in this. Congenital absence of limbs. By 7 weeks of embryonic life, the formation of all parts of the upper and lower limbs is completed. The most limb deficiencies occur in the period of limb morphogenesis, when there is a rapid proliferation and differentiation of cells and tissues. This is the sensitive period where the limb formation peaks in the 5th and 6th week of fertilization. Thus, major malformations like absence of long bones can appear by the 7th week of the fetal development, depending on the time and severity of the abnormality development in a periodical table. Unlike malformations, deformations change in the formed structures because of the external forces, and it can occur any time during the fetal development. Now let us see what are the most common congenital limb defects. They are complete or partial absence of the limb, such as fibula hemilia or congenital absence of tibia. The failure of a portion of limb to separate, commonly seen in fingers or toes. Duplication, sometimes we see an extra finger or two. Overgrowth, the limb will be much larger than the normal limb. Undergrowth, the limb is much smaller than the lower limb. Limb deficiencies. It refers to any number of skeletal abnormalities in which the arms and legs are partially or totally missing due to birth or by accidents. Upper limb abnormalities. It affects young persons' arms or hands, and most children function well, and sometimes they can hold and move objects also. Lower limb abnormalities. Affecting the young person's legs or feet. They may require footwear and occasional or permanent use of wheelchair. Traumatic crippling. Amputation, that is medical surgery done by a surgeon to remove a limb or a part of limb that is no longer useful. Brittle bone disease. Brittle bone disease is genetic inherited disorder which causes the bones to break easily. It may affect the stature, muscle tone and coordination. The breakage may occur during the growth spurts, and it can happen even with the smallest movements like the shutting of the door or lifting any object from the floor. Spina bifida or hydrocephalus. Spina bifida is a neural tube defect in the development of spinal column. It can cause minimal or complete paralysis of spinal cord. What are the problems faced by these orthopedically handicapped children? Let us see. Psychological characteristics of orthopedically handicapped. They are passive, less persistent, they have short attention span, they engage in less exploration, they are more dependent on adults and have high anxiety and frustration, they are tender-minded, they possess poor ego and unconscious guilt feelings, they have strong sense of fear and lack of confidence in their abilities. A child who is orthopedically handicapped is usually not mentally handicapped, but the child deficiencies are most evident in the areas of the mobility, motor coordination and social interaction. The child's physical limitations are varied as the conditions causing impairment. They also have emotional problems. They may develop in the children who have been rejected or isolated by their peers as a result of their handicap. A child with physical problems also have difficulty moving either a part or all of his body. Sometimes a small part of his body like fingers, toes are affected. Sometimes the child cannot walk or sit up alone. The children with physical disabilities may not be able to walk or move in a usual way. They may be very clumsy. They may fall or stumble very easily. They have trouble in controlling certain parts of their body. They need special equipment like the crutches, wheelchairs. So, if you have to take care of the child, you have to give extra time in play activities so that they will learn to balance themselves. You have to arrange rooms with lot of open spaces between furniture. You have to use a special railings or ramps. You have to provide activities that use many parts of their body. And you can also have extra lifting or carrying if the child has problem walking. Now, so we will see in detail what are the strategies for helping a child with physical impairments. Let us see. You can create a safe environment for all children. The safety planning must include the specific needs of the child with physical impairment. Make play materials and play areas accessible. Remember, a child who is using a walker or is not able to get around easily, and he may not be able to get around from one place to another place. So, it should be accessible to all the children. You have to select the toys, play material, play equipment to encourage social interaction. Social interaction, it should include all the children in activities. For example, a child with physical disability may not be able to play, but she can be involved for taking scores. She may not be able to jump on a rope, but she can turn the rope. See, you have to look out for the meaningful ways of involving all the children. Arrange your environment so that the children with all kinds of abilities can explore, play with the things you provide. You have to create an environment that allows every child to be as independent as possible. You have to be creative using ordinary items, and that should be useful for the child. Change rules whenever necessary. Adjust the rules of the game so that all the children can play. Give the children an opportunity to express their concerns about physical disabilities. Respond to their questions in a casual way, but it should be an honest answer. Brainstorm about the solutions to various situations. Ask the child for guidance, try different solutions, consult with other people, and keep looking at the ways to make things more accessible to the child with special needs. General strategies. A teacher can generally accommodate the students with physical limitations by ensuring that a student with physical impairment feel accepted by other fellow students. Make allowances for a student's high level of fatigue. Ensure that the environment is physically accessible and safe. Provide for peer group understanding and interaction. Provide appropriate adaptive equipment and technology. Modify the demands for volume of work produced. If a concept is understood, extra practice may take more time. For this, the student is warranted. Provide time for reteaching. Instruction may be paced differently for a student with physical disability. Provide instruction in the use of assistive technology. Ensure total support for the use of technology. Allowing alternate methods of evaluation to compensate for physical limitations. Engage peers in support. Ensure that there is adequate opportunity for involvement in extracurricular activities. Ensure that the field trips are fully accessible. Now, let us see what are the practical tips for teaching the child with developmental impairments. Use simple words and sentences, using real objects rather than abstract teaching. Do one activity at a time with the child. Make it clear when one activity is finished and other is starting. Break a task down into small steps or learning objectives. The child should start with an activity and that he has already before moving on to something or the next activity. Try to link the tasks with the child's experiences or everyday life activities. Give extra practice by repeating the task few times. Repeat few main tasks that has certain intervals so that it becomes a habit for the child. Ask the other children. The other children means who are academically good, to help or assist their classmates with developmental impairments as a part of their own social and academic development, which can be mutually enriching. Be generous with the praise. It should be a honest praise, and encourage when the child is successful and masters a new skill, as well as when she is striving hard to achieve the skill. Motivate the other children in the class to include the child with developmental impairment in and out of the class play or sport activities, which can also be mutually enriching. Ignore undesirable behavior if the child is doing it to get your attention. Give the prize and attention when the child behavior is good. There are three main principles for teaching children with physical disabilities, or in the matter any type of developmental impairment. Divide the skill development into small steps and allow for slow progression. Make frequent repetitions. Give a lot of praise and motivation. If these principles are followed in a classroom by the teacher, then the education of physical disabled child will not be a problem. He can be as successful as any other normal child. So, today we have understood what is physical disability. We have understood it as a limitation to the person's mobility or dexterity. We have also seen what are the different types of physical disabilities like the arthritis, multiple sclerosis, and how they can be treated and diagnosed. And we have also seen what are the problems these physically disabled children are facing. And then we also try to understand what are the teaching devices that can be used to help the child with physical disabilities. Hope you have understood the lesson and enjoyed it thoroughly. Thank you.